Welcome to the Medical Marijuana and Wellness webinar. Tonight's topic is managing pain, both chronic and acute pain, using medical marijuana. Probably the number one reason why people use cannabis is pain management. It's been sought after as a treatment for centuries and has proven results. Tonight's sponsor for us webinar is Surterra Wellness, and I have a couple of folks from Surterra that's going to help me address this very important topic. First of all, I'd like to introduce Forrest Haag. Um, Forrest, tell us a little bit about yourself and how you can help us tonight.
Hi, Mark. Thanks for having us. It's great to be here again. We are stoked to be here talking about pain. It's a big problem, especially down here in Florida. We know that we deal with a lot of patients with it. So we are very excited to be here talking about it. I also have with me Keanu Reeves here. And he is one of our expert guides here at our Bonita location. I'll let Jesse introduce himself.
Yeah, Jesse, welcome. Jesse, we lost your sound. You got to give us some sound here, guy.
Sorry about that, guys. So this is my first time doing a webinar. I'm super excited to be here and to help you guys out with this. So basically my position is going to be a guide at Surterra Wellness. Hopefully a lot of the people that are joining us for our webinar in the audience have maybe before at the Bonita Springs location. Just for the last 3 years, I've had a very extensive, very intimate relationship with cannabis to really understand how it works, and most importantly, how people can properly use it, because unfortunately, a lot of people do kind of get caught up in the pop culture aspect of it, not really the wellness aspect, and that's what we're trying to change.
Yeah, I think it's really important to point out that really there's two dynamics to cannabis. One is recreational use, which is fine. A lot of people enjoy that. And there's also a more important part, which is the medical cannabis side, which is the ability to be able to really get your life back, to reduce pain, inflammation, a lot of the conditions that we face. And really, that's something that we are really here to help answer those questions and bring forward that information. I do want to mention to everybody that tonight's webinar is going to be one where you can ask some questions. If you look at the bottom of your screen, you'll see a little Q&A button. Please feel free to ask questions. Now, before the webinar, a lot of you have submitted questions, and we'll answer those at the end of this presentation, and then we'll get into the live questions that come into play. And not to mention, we're going to learn a little bit about where you can get some products that can help you with your pain. So that being said, I prepared a video on this particular topic. Let's play that and then get into the questions and answers. Welcome to Medical Marijuana and Wellness. Today's topic is managing chronic and acute pain with medical cannabis. So let's talk pain. Chronic pain is one of the top conditions cited for long-term disability in the United States. It's a persistent pain that patients complain about and often is misdiagnosed primarily because it comes from one or two sources or two or more sources, so it makes it very hard for the doctor to pinpoint exactly what the primary pain point is because there's multiple pain points. Pain is interesting because it's a combination of a number of things. It could be something as simple as the emotions, the sensations, or the psychological factors that come into play, which triggers trauma, which triggers fear, which triggers stress. It also can have to do with a muscle response. You hurt your finger, you stub your toe, you feel your heart rate goes up, your blood pressure increases, you're sweating. That's when you know that you're in pain. And also it brings on something called the fight, flight, or freeze syndrome, where you look at what you're going to do in a particular situation. It really triggers your reaction to many different situations that we find. Now, again, as we mentioned, acute pain is something that can happen where you may swing a tennis racket and you tear a muscle and it's going to hurt you. That will go away in a few months. Although if it continues, and especially if it is related to having a shoulder injury or some other knee injury or something like that, it'll trigger what's called chronic pain. This is something that lasts for more than 3 months. In either case, you're in pain, and it's something that needs to be addressed, and that's what we're going to be talking about. Now, how does medical cannabis work with pain management? Well, we know there's a number of studies, clinical studies, that have been done on chronic pain, on ALS, on epilepsy, anxiety, cramps, insomnia. Different states will allow pain and pain management to be one of the conditions that qualifies you for a medical cannabis card. What's interesting about cannabis as an alternative is for pain management is it's safe. World Health Organization has reported no fatal overdoses of cannabis, either used recreationally or medically. It offers an option for patients who've exhausted all the conventional therapies. And it also gives people that are trying to wrestle with opioids an exit, not an entrance, an exit opportunity to be able to manage your pain without opioids. Hemp is interesting, comes into play because both hemp and marijuana are classified as cannabis. Just like there's roses and there's different types of roses, cannabis has a couple of different varieties. One's called hemp and one's called marijuana. Now, hemp is defined to be 0.3 or less THC content. If it's more than that, it's considered to be marijuana. And that's really more of a, less than a medical, it's more of a legal definition. So because by being 0.3% or less THC, it's now federally legal and it can be sold around the United States. If it's above that, then it's something that has to have a medical marijuana program because it's still federally illegal in the United States. Hemp historically has been used more for building material, ropes, hygiene products, although lately has been used quite a bit for hemp CBD products. Marijuana typically has been used to either get high and or by medical cannabis users. One is a tall, thin plant. That's what the hemp plant looks like. One is kind of a squat little plant. It's a bush. That's why they call it a weed. There is a difference between them, and they really have different medical values associated with them. Now, how does cannabis and chronic pain come into play? Well, because compared to other alternatives that you have, the number one reason that people turn to cannabis is because of chronic pain. It will lower your risk of addiction when you take a look at other medications that are out there. Again, there's no fatal overdoses. That's very, very important to point out. Cannabis does not hurt your body, as opposed to a number of medications that really attack your kidney and your GI tract, and there's also no issues related to liver damage. It's a very healthy alternative looking and very effective alternative when you look at pain management. Now, how do we know this? Well, in the United States, because cannabis is illegal, it's a Schedule I drug, University of California did what they call a clinical trial, a clinical study, where they went out and actually found patients that were using cannabis for neuropathic pain and measured their response to them. And they found it was very effective. McGill University, which is in Canada, actually has done studies, significant studies, to see how cannabis can help relieve pain, improve sleep, and really help patients with refractory pain. In all cases, it's shown how cannabis, again, using studies, has shown that it does work. And in fact, in the 2019 study, it showed that 80% of the participants found that it was very or extremely helpful in managing pain. What does cannabis evolve to? Well, when we started looking at cannabis, when I started looking at cannabis, I heard about the famous indicas and sativas. Indica is relaxing, sativa is more uplifting. Really, we've evolved with the different ways cannabis is being produced, where they're now producing what they call chemotypes. Chemotypes are a combination of the strains as well as the terpenes that target a particular condition. So terpenes are very, very important because what they do is they bring the medical properties to cannabis. Cannabinoids are important because they target the various receptors and really introduce the terpenes to those particular receptors. So it's a combination of the terpenes, cannabinoids, and also flavonoids working together. And again, finding that what they call that sweet spot. How much do I take based on my individual body dosing? Every person's body is different, just like alcohol and just like caffeine. Some people can have one drink and be done for the night, and some people can drink the whole bottle and just be getting started. It's interesting that in the area of cannabis, it's important to go low and go slow, but find your therapeutic value or your therapeutic tolerance level. Once you do that, you'll know how cannabis is working. Your body will tell you, and you'll know exactly what the right dosing is for you. Now, how effective is cannabis with respect to pain? I'm not going to go through every one of these studies, but this is an example of a lot of studies that have been done on cannabis and pain. And I will point out almost all of these studies have been done outside of the United States because it's a Schedule I drug here in the United States. Let's play a little video from Sanjay Gupta on this subject.
Plus ingredients. The two scientists know the most about are THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical, We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies.
So it's interesting that we now have a situation where cannabis was put into this Schedule 1 status or made illegal more for political than for scientific reasons, and that's really, really important. So why is cannabis such a big deal? Well, when we take a look at our nervous system, which we all know we have one, and we've all felt it's been something that's a major part of our body and the way our body works, we know that if we hurt our finger, bang our knee, the signal is sent to your brain. I call it our nervous system being the cell phone system of your body. It goes up to your brain and says, Houston, we have a problem, and we have to do something about it. The question has been, what did Houston do about that? What we found out by studying cannabis is that our bodies have an endocannabinoid system. What does the endocannabinoid system do? Well, it's where Houston hands the problem to the endocannabinoid system, and this is where endocannabinoids are produced to help manage pain, anxiety, appetite, inflammation, and the immune system. Very, very important part of our body and in every mammal that's out there. Our body likes to stay in what they call homeostasis. That's a body that's in balance. It does that by using endocannabinoids, which it produces naturally in our bodies. So we, in essence, are producing our own cannabis. Phytocannabinoids, which are produced by the plant, have an interesting structure in that they identically match or look at and identify with the cannabinoids in our body. So if we're deficient in certain endocannabinoids, we can make them up by putting the phytocannabinoids from a cannabis plant into our bodies, and it basically binds to the same receptors and brings the same relief that we're looking from the endocannabinoid system. So in essence, it helps your body stay in homeostasis or stay in balance. Why would you need it? Well, for example, I'm a senior citizen and I don't produce as many endocannabinoids as I used to. So it helps that your body now has something that could manage itself and be able to get it into quantities that it needs. Now, cannabis itself is broken down into three parts: cannabinoids, terpenes, flavonoids. Cannabinoids, as I mentioned, are the ones that join with the receptors. They introduce the medical properties of cannabis to those receptors. The terpenes, which is really the strain and the smell and the taste, brings medical value, and is introduced into the body through the cannabinoids opening up the receptors. And flavonoids really give you the color and some of the taste that you find in the product, and it works great for anti-inflammatory, neuroprotective. It helps for disease prevention. So again, cannabinoids open up the receptors, and the terpenes and the flavonoids bring the medical value to your body. This is what they call the entourage effect. All of them working together, one and one is more than three. And that's what's really, really important. They working together, they synergistically help to enhance their medical properties. And a couple of things that are important. One of them is CBD, for example, lessens the psychological high effect of THC. So many people that are dosing, trying to figure out what their tolerance level is for THC, if you get to a point where you take a little bit too much THC and you're uncomfortable, take an equal amount of CBD and it'll bring you back down. It's something that helps you be able to counter that. It's what they call a rescue. It can be a rescue product. And also working with terpenes, it helps bring the medical efficacy to your body, and they work together to bring medical benefits. This is something that's really important. Now, we've heard about the different cannabinoids. Major categories are CBD, which is found in the cannabis plant. Again, we mentioned it's also found in hemp. and it targets the CB2 receptors. These are receptors in your peripheral organs and your immune system. Not psychoactive, but it really is great for inflammation. THC, or something called delta 9, is found in cannabis. It also is in quantities of 0.3% or more in the cannabis plant. Because it targets the brain and the central nervous system, it can have psychoactive effects, although they can be managed, again, by using CBD and by your dosing regime. But it's really important, especially if you're managing pain and you're trying to address certain issues like anxiety. CB1 is really important. Delta 9 is really important in part of that regime. Now, there's also something called delta 8. And what's the difference between delta 9 and delta 8? It has to do with the configuration of the molecule itself. It is less powerful than delta 9. In other words, it will give you a psychoactive effect, but it's very mild and it's not as high. A lot of people like to use delta 8 basically to try to use it recreationally, and you've got to take an awful lot of it to get it to work. I'm not a huge fan of delta 8 for a number of reasons. Primarily, it's a great product or a great cannabinoid, but the production of it in the United States hasn't been regulated, and you've got to be very, very careful with delta 8 products to make sure they have an up-to-date, accurate, and quality certificate of analysis. Looking at the CBD itself as a product, you'll find that here at CBD itself, as I mentioned, addresses not only the CB1 and CB2 receptors of the endocannabinoid system, but also a number of other receptors in your body. This is the ones that help you with blood pressure, for example, inflammation, helps you regulate pain through the body temperature. It also helps you with epilepsy and seizures, and also can help you with sleep. This is the byproducts of CBD itself. And what we're finding is it's becoming like it's like a super vitamin for your body. What are the effects? CBD handles more, as I showed, handles more of the receptors than just CB1 and CB2, but both of them, both THC and CBD, really work with the immune, peripheral organs, inflammation, and also your peripheral organs throughout your whole body. A key to being able to manage pain is to get the right terpenes. As I mentioned, the terpene profiles are really, really important. And the key terpenes to look for when you're trying to manage pain are limonene, as you can see, the anti-inflammatory property here, the pinene, which is great for pain relief, as well as anti-inflammatory, myrcene, caryophyllene, and eucalyptol. These are the primary terpenes you're going to be looking for to manage pain. That's found in what we call the cultivars. So there are different strains that have been put together. And if you look at the terpene profiles of the different cultivars that are there, like ACDC, you'll see the myrcenes, the pinenes, the caryophyllines that are in here. In the case of ACDC, it's a CBD dominant, meaning it's more of the CBD product. The other products are CBD, THC dominant that are down here. But it's interesting that CBD plays an important role, and that you can see the myrcenes, the pinenes that are in, caryophyllines are in all the different products that are out there. How do we take it? Well, there's really a couple of different ways. The nice part about cannabis is you're not stuck taking just one pill. You can use a sublingual drop, which you put underneath your tongue. Typically takes about 15 minutes to 30 minutes to work, and it'll last 4 to 6 hours. Or a spray. Same thing, you can put that inside the mouth. The blood vessels inside your mouth absorb it and bring it into your body. Very effective, and probably the easiest way to learn how to use cannabis is using a sublingual drop at a ratio of 1:1. Oral products are very famous. These are your gummies, these are your edibles, these are your chocolates. Very, very effective. They'll last for up to 10 hours. And that's what's key. If in the evening you want to be able to just sleep through the night, you taking something about 2 hours before bed will really, really make a big difference. Now, you've got to be very careful because oral products take up to 2 hours to work. And that's what's really important. About the time you think they're not working, the time you take another one is it starts working. You have to be very, very patient with both edibles and also with capsules. Topicals are very effective because you rub them on. Some of them will actually absorb directly into your brain, go into your bloodstream, and some of them will just stay on the derma on the outside. But they're very, very effective. Topicals work almost immediately and will last a couple of hours. And there's also patches that are available that can last up to 72 hours. Inhalation is the most famous way cannabis is being used. Smoking flower is one way, using concentrates or inhalation pens are another way. Important to point out that cannabis is very sensitive to the temperature of which it's being burned in the case of inhalation. If you take that 500-degree flame and put it to the end of a joint, you're going to burn off half of the cannabinoids, all the flavonoids, and all the terpenes. You reduce the medical efficacy of that joint down significantly, maybe over as much as 60%. That's the bad news. The good news is it still works. And so flour is one way of using it, but if you really are interested in that, buy a concentrate and use a concentrate pen. Again, it'll work almost immediately, but you can set the temperature of that pen. And based on being able to set the temperature, you can target various terpenes, as I mentioned earlier, the terpenes we're looking for, to be able to get the relief that's there. Many people who smoke flower say, I'm not getting any relief from pain, and yet they'll find out if they use concentrates, they do. And the difference is they're bringing out the best of the terpenes in that particular, with using a particular product. Examples are, for example, we talked about the pinene, the beta-caryophyllanes, the myrcenes, the limonene. They all triggered by lower heat. And by being able to have a vape pen that you can actually set the temperature on, again, this comes from using concentrates, or it comes from using a dry flower device that lets you set the temperature. It's really best for enjoying the natural flavors, bringing out more of the terpenes and cannabinoids, and really for a lot of newcomers, especially medical patients, this is the temperature setting that you want to set. As you set up higher temperatures, a lot of people will do this both for the limonene and also for the linalool, the relaxing aspects of that come into play. And you can see the high temperature marks down here, bringing again the beta-caryophyllanes that are here. So the temperature setting, if you're using a vape pen, is absolutely critical. And most of the temperature settings, when you buy a vape pen from a dispensary that doesn't have a setting, is usually set to either medium or to high, and ask them which one you're getting. Very key to using medical cannabis. I want to thank you for taking the time to look at our video. To learn more about us, please follow us on social media, on Facebook, and also on YouTube. You'll also be able to tune in weekly to the Medical Marijuana and Wellness webinar series. On Wednesday nights, we host various subjects, and please join us for that. Thank you very much for joining me, and I look forward to hearing from you. Well, thank you very much for watching. This is very, very key to understanding the benefits of medical cannabis. Now, I do want to mention one thing. We have been nominated for an award that's called the Cannabis Action Awards. It's been Normal has been kind enough to nominate both myself and also the platform. And if you don't mind, I'd like to ask you, if you like this video, if you like what our program is, please contact them. Please contact Suncoast Normal and vote for us. We'd appreciate that. And naturally, we want to get some recognition for what we're doing, but it really comes from you, whether we are, in fact, helping you with your medical cannabis issues. Now, let's jump into some questions that people have regarding medical cannabis. I know this is an important subject. And really, before we do that, let's target and talk about the products that can help you. I know there's a lot of theory of, use terpenes, which cultivars. Let's get down to where you can actually go to a dispensary, pick up a product, and have something that helps you with pain relief. And Jesse, can you tell us a little bit about that?
Yeah, absolutely. So here I put together a couple of different products that we actually have at Surterra Wellness. The first of which is going to be the topical lotions or balms. Now, the one that's pictured is the Fix 1-to-1 Infused Balm. Now, this is really good for people who are looking to, people that work during the day but can't really take the euphoria that normally comes with THC. Now, any type of topical lotion or balm that you use is not going to have enough THC to break through the blood-brain barrier, so you don't have to worry about any type of inebriation while you're using it. So this is great for people that are at work all day that maybe need to just have a little bit of relief, especially when it's aches and pains in the body. So next we move on to indica strains. Now, there's going to be a lot of strains, almost all strains that are going to carry some form of pain relief, whether it's sativa, hybrid, but mostly indica. The two that I picked are Animal Larry, which actually just happens to be my favorite strain that we carry. It is incredibly powerful, incredibly potent, but also very, very effective. If you have any type of pain, it makes it wash away. You feel very, very happy, very euphoric, very relaxed, very sedated. It was one of my favorite strains, comes very highly recommended. And the second is 9-Pound Hammer. We don't carry this at Surterra Wellness, but it is a very, very well-known strain. Also a lot of sedation, a lot of euphoria, but a lot of people do use indicas to combat any type of pain that they may have. Like I said before, the sativa and the hybrids do carry some pain relief properties, but it's mostly going to be the indica that you're going to want to look at.
But I think you're also, what's key here is these strains that you're talking about are really cultivars. You mentioned down below the best terpenes. They include a lot of those terpenes in those strains. In other words, they're really designed for addressing pain.
Yes, that is correct. Probably one of the most effective one that I've seen that my patients really respond to is the first one that you see on the screen, which is myrcene. Myrcene is probably going to be the most common that you find in indicas. All the other ones behind it definitely do have their properties as well, but myrcene is going to be probably one of the most common terpenes that you could find in cannabis. So the next product on the slide is going to be the FSO syringes. Now, FSO is also known as RSO in some other dispensaries, known as Rick Simpson oil. We call it full spectrum oil. This comes in both sativa, hybrid, and indica blends. This is something that I would probably give to somebody who needs a little bit extra pain relief, because the thing about this is that it's very potent. A lot of people do normally have vape pens, and you'll notice that the oil in there is going to be clear. They strip out all of the cannabinoid or all the plant lipids and the chlorophyll. This product actually retains all of the product of the plant. That's why it's called full spectrum, harnesses the full power of the plant. So this is what's going to be taken orally, as we had mentioned before, the routes of administration. The best way I would think is just to put it the size of a grain of rice on a scoop of peanut butter and just eat it like an edible, and you're going to get the effects that you look for.
It's interesting. You call it FSO or RSO, which is Rick Simpson oil, is very, very effective at addressing not only pain but also other conditions like cancer, for example. There's a lot of testimonials and information on that. It really is the whole plant, and that's what makes it really as good as it is. But I tend to look at it as like the 151 Bacardi of the cannabis line. It is very strong, and when you use it, I think you have to be fairly careful. In other words, like you mentioned, a grain of rice on some peanut butter will probably do the trick. You don't need to get a lot of it.
Yes, very correct. Like I said, that's always what I tell people is go low and start slow. You're just going to want to be able to try a little bit at first, because a lot of people think I can handle it. It's not a problem. I've been smoking for a while now. Any type of concentrates or anything that you're going to be taking that you're not familiar with, always start with a lower dose. That's key information when it comes to this. You do not want to have a bad experience, because we're all trying to combat the pain, and it takes a small amount of the FSO to do so.
Right.
The last
Great product. Just be careful.
It's fantastic. I use the indica quite religiously. It is definitely a mainstay in my stash, I guess you'd say. We lost
Jesse for a second. I think Jesse was talking a little bit about, Jesse wants to get into talking a little bit about orals, the oral products that are there. I know that we talked about tincture drops, which the sublinguals you put underneath your tongue, they help great. They do a lot to really help with not only just your particular condition like pain, but also can help you with things like sleep and also things like inflammation. Now, the key is, what's really important about Surterra, I believe that sublinguals, is they've maintained the terpenes in the product. A lot of dispensaries that when you go out and you look at the dispensary drops that they have, they'll talk about the isolates, but they don't have any terpenes. Without the terpenes, you're not going to get the medical benefits, and I think that's one of the benefits of working with a Surterra product in the Surterra company. Jesse, are you back? Did you get your audio back?
Yeah, I think. Can you guys hear me?
Yeah, I can now.
Okay,
But
fantastic.
tell me a little bit. I just kind of covered the sublinguals, which are very important. I think it's also important to point out that once you find out your therapeutic tolerance for THC, in other words, how much you can take. And I use sublinguals as an example, whether it's 0.25 or 0.125 or 0.25 amount of the product, and then more than that, you actually get some negative effects, which means you want to back it down. But you can also then start increasing the amount of CBD that you're using. I know my wife, for example, uses a 12 CBD to 1 THC product, which she gets from Surterra. And I think that's an important part of the whole dosing and the product line.
Yeah, the oral and sublinguals is probably the most popular thing that we have on our shelves. I have people that come in that almost exclusively get the tinctures just because they are so effective. I put down the Relief and the Dream formula specifically because those are going to be the two top ones that I would suggest for pain relief. Obviously, Relief formula, it's in the name right there. That's what it combats, is going to be the pain relief. The Dream formula I also picked because a lot of people do have a tendency to wake up in the middle of the night and start to feel the pain start to come on, and it kind of prevents them from going back to sleep. The dream formula is great in the fact that it puts you to sleep and keeps you asleep all night. That way it reduces the chance of you waking up with pain. So these are both going to be the highest THC content. They're on a ratio scale. We talked about the entourage effect earlier in the video. This is a perfect example of that. So you have all of your THC, CBD, all of the tinctures are going to be on some type of ratio. And as you said before, Mark, I think that people that are just starting out with this product would probably be better suited with a 1-to-1 tincture, just to see how their body is acclimated and how it affects them.
And then maybe move to a 2-to-1 or a 3-to-1. I know that in my particular case, I have to manage inflammation and pain. I actually go to a 1-to-4. I usually 4 THC to 1 CBD, because pain, unfortunately, is something that has decided to become a resident in my body at this point in time. Now, I do want to point out, we talked about terpenes. The Dream and the Relief product are 9-to-1s, but the real difference between them is the terpene profile. And that terpene profile, again, from a cultivar standpoint, gives 2 different effects. Even though I might have lost Jesse for a second. But the point is that it's fundamentally, you'll see these nut ratios like 9-to-1, 4-to-1, whatever. And what you really find out is the terpene profile is really what brings the medical value that's there. And that's hence why they have different products that are out there. And it's something that's really, really important. Again, I'm going to emphasize, and I can't emphasize more, the benefits of using a Surterra product, especially for the terpenes, because really that's the true medical value that's there. And it's something that I know I use, and I use it for the very simple reason that the products work. And the reason they work is because of the terpenes. Unless Jesse. Okay, so let's move on to a few questions. Let's see what questions that have been submitted to us. Now, these were questions that were submitted prior to the webinar. We'll go over some of these, and then we'll kind of get into the questions that we have. What are the best terpenes to manage pain and maintain brain focus? You know, I can't think things that make me drowsy during the day. I don't know, Jesse, do you want to attack this one, or do you want me to take it? I don't know if Jesse's back online or not.
So Jesse's not here, but I can take this one. I would go, if you could go back to the slide before that showed some of what Jesse was showing there. If you stick to, for instance, the things like on the left, the topicals, the balms, things like this that are going to apply directly, you're not going to have a high with things like that. So it's going to allow you to stay focused during the day while not maintaining a high, getting on clarity, things like that. So if you're worried about something like that, I would stick to topicals, lotions, balms, patches, or conversely, products that have high CBD in them, lower THC, high CBD. So as they were talking about our ratio products, for instance, we have a number of different ratio products from 1-to-1s, 1-to-4, 1-to-9s, and all the way up to, I believe our Tranquil is 19-to-1. So higher CBD, lower THC will also help you with that as well.
Yeah, it's really important that 12-to-1 or 19-to-1 really helps a lot with anxiety, stress, and by relieving the inflammation in your body, it helps to reduce the pain. There's a lot of people that say, well, I use CBD and it reduces my pain. What it's really doing is not addressing the pain as much as relieving the inflammation. When the inflammation goes down, your pain level goes down. You really, to address pain, you need a certain amount of THC to be able to really go after the pain issue. But relieving inflammation is really important to be able to manage pain. And it's something that I, for example, pay attention to quite a bit. Let's bring back to the questions here for a second. The question becomes, which products help with inflammation? Really, almost all of the products. Let me back up a little bit. First of all, a lot of the products that we have for pain on the market today have some negative side effects, whether that's for your liver, your kidneys, whatever. Okay, and a lot of them are not designed to be used on a regular basis, to be used constantly. In my particular case, I have 7 herniated discs in my neck. I have 2 herniated discs in my back from an auto accident. And being a senior citizen, I have gone through the ambiance of 2 knee surgeries, which I'll address later in some of the questions that Jeffrey and a few other people have brought up about knee surgery and pain. But what's interesting is that cannabis will reduce the inflammation, but it's not going to have that negative effect on your body. I think that's really, really key. And it's something to really take a look at. Which product can help? Anything that has a CBD in front of it will help tremendously with inflammation. Also, the products that you saw from the terpene standpoint, So when you see the myrcines and you see the limonene and you see those products, they'll help you quite a bit with inflammation. One of the questions that have come up is I have surgery and can't take pain medication. Which product should I use to keep my pain down 24/7 as I recover? I can absolutely relate to this. I had a knee replacement. I've had both knees replaced, left and right, but I had my left knee replaced, and it was done about 4 years ago from Jewett Orthopedic, which is here in Orlando. And I was actually their guinea pig for using medical cannabis as opposed to pain medication post surgery. And what's interesting is pain. In this particular case, this was acute pain because obviously they replaced my knee, and it's something that is going to be there for 24/7. So I had to pay attention to making sure I had a product that when I woke up in the morning that would address the pain. In many cases, I used a tincture drop in combination with a vape pen. So when I woke up in the morning, and in fact, I even do this today. It's the same regime that I use today. Is when I wake up, I grab a vape pen and I'll take 1 or 2 hits off the vape pen because it works almost immediately, and it'll take my pain level, which sometimes can be as high as a 7 or an 8, but in many cases is like 4 or 5. They'll take it down to below a 1. Now, that'll last for about an hour or two. So what I do is I take a sublingual drop, and that'll last for anywhere between 4 to 6 hours. Now, in my case, it takes about 20 minutes for it to work, and it'll last about 5 hours. That'll take me in the morning to the middle of the afternoon. In that particular case, what I do then is I then take another tincture drop to be able to keep drops in order to keep me going in the afternoon. And I do the same thing in the evening. I'll use the products that are there. And in many cases in the evening, I'll also use a concentrate to be able to help me be able to manage the pain that's there. And then most importantly is one of the problems that you have when you go to sleep at night is you want to sleep anywhere between 7 to 10 hours. If you take the tincture drops, which last about 4 to 6 hours, or you take some of the topicals, which like an hour or two, what happens is you don't get the coverage through the night. So being a chocoholic, I take a little square of chocolate. It lasts me between 8 to 10 hours. In my case, it lasts about 8 hours. So I do that about an hour before I go to bed. Take some chocolate. It helps me fall asleep. It helps me stay asleep. And that product will take me through the night. And I think it's important that you cover what I call coverage of 24 hours a day, because the herniated discs in my neck and the pain I get from my knee surgeries are not going to go away. This isn't something that's going to, I wish it would go away. But unfortunately, I'm kind of stuck with it. So I've got to manage my pain on a 24-hour basis. And I hope that helps. I hope that helps explain that. Now, in my particular case, I was the guinea pig, as I mentioned, for Jewett Orthopedic. There were 5 of us in this particular study. I used medical cannabis. The other 4 used various versions of opioids. I was able to take my pain level literally the day after the surgery. The day I left the hospital, I took my pain level down to below a 1, and I kept it there, and I've kept it there since. This is not the case for the folks that were in opioids. And in fact, in the case of our particular experiment, 3 of the people that were on opioids switched to medical cannabis. One of them went away. I don't know what happened to him, so I can't give you that. But it's something to pay attention to. Send an email to events@marijuanaaware.com, and I'll send you my regime that we have out there. In fact, I'll include it in the post follow-up email that you get, so you can see the regime I use to cover myself for post-surgical pain. Very effective, very, very effective. And again, what I would recommend though is talk to your medical cannabis doctor before the surgery, get the products that you're going to use lined up, experiment with them. Your body will tell you what will work and what doesn't work, because in every case, your products are different, and make the adjustments for the pain as you go along. Go low and go slow, and hopefully it'll help you. Next question. I recently stopped taking painkillers. Wonder if is there a best transition strain to help? Really, I'm not sure that there is a particular strain. I think there's a transition. Jesse, do you want to address that?
So when it comes to waning off of painkillers, it's a little bit tricky when you're introducing cannabis into it, because a lot of people do like to think that it is a cure-all, which it is not 100%. It's definitely 100% helpful, but when you're doing a transition from taking painkillers to just going to cannabis, I think it's best to probably just slow down the amount that you're taking. Definitely wean yourself off at a at a gradual pace. And then once you get into more using more CBD and more THC instead of the painkillers, I think that you'll definitely feel a lot better as well.
Yeah, I think it's important to point out, you don't want to really go cold turkey. You just don't want to stop one day. What you want to do is you want to use a lot less of it, a lot less of the pharma drugs, and a little bit as you ramp up a little bit of the cannabis. But as a cannabis practitioner, I can tell you, listen to your body. Your body will tell you what works and what doesn't work. And that's what's really, really important. A lot of people will say, well, how much should I take? You know, I think the pharma likes to tell you, take 2 pills and call me in the morning. And their whole system is based on weight. And yet we all know that everybody's body is different. We know that some people can drink 1 glass of alcohol, can take 1 drink and they're good, you know, they're done for the night. Some people drink the whole bottle and they're just getting started. Cannabis is the same way. You have to really find out what your tolerance is. And once you find out what your tolerance is to CBD, or should be to THC, you can then augment and increase the amount of CBD to find out what the best balance is. Your body will tell you by going low and going slow. Your body will absolutely say, you know, I'm feeling good, feeling great. Took a little bit more today. I'm not feeling as good, so I'm going to back down to where I was yesterday and go from there. That's why journaling when you're dosing is really, really important. So I would say the best thing to do is just gradually get off. Take 3 to 4 weeks to do that. And that's what I recommend. Go low and go slow. One of the questions is I have chronic pain and knee pain, and also have really bad anxiety. I can relate to that. What is the best route to take to help me curb pain? I think I just went over that, and we'll send you that regime. What you need to do is pay attention to the fact you got to have a regime that lasts 24 hours a day to cover you the entire day. I hear a lot of patients that come to me and say, well, I took it in the morning and it's not working. And that's because typically in the afternoon it's worn off. Jesse, you've seen a little bit of that, haven't you?
Yeah, quite a bit. When it comes to anxiety, this is probably the most common thing that I get from patients. The anxiety is, I'd have to say, probably about 50% of the patients that come in are looking for a way to kind of just calm the world down around them. And yeah, there's plenty of products, definitely quite a few that we've covered today that would definitely help with that. Pinene works for me. I have really bad anxiety, and pinene definitely gives me the focus and calms me down. That's probably one of the best terpenes that I could take for it.
For pain, pinene is probably the best terpene that you'll find out. The pinene and myrcene are the two. I would put pinene is typically one of the top 2 that you really want to pay attention to. And again, when you go to the dispensary, you go to Surterra, basically ask them, and they'll give you the terpene profiles. They'll let you know what's in the product that are there and help you be able to find the right product for you. One other question comes up. I have a pelvic floor dysfunction and it's painful. It is absolutely. Throwing out your whole pelvis is not fun, that's for sure. What is the best way to handle pain? I think what I mentioned about the way I approached my neck and my knees is exactly how you want to approach the way you have your pelvic floor, which is to have a products that address the morning. One of the reasons I take a vape pen in the morning is because, and it just surprises me that if I take a hit off a vape pen, literally within a minute or 2, it almost feels like somebody took a rag and wiped my back and the pain went away. And the first time that happened, I told my wife, "This is just crazy. It's unbelievable." And even when it happened this morning, this is like 7 years later, I still am amazed how fast it really helps with the pain. Again, I have a high level of pain. Sometimes my level of pain when I wake up in the morning can be a 7 or an 8, and be able to get down to a 1 is really important. So I think go low, go slow, but find out what your tolerance is, and then build yourself a 24/7 regime. Next question is, I am new to the medical marijuana game, and suffer from 2 herniated discs in my lower back. Why did the tincture not work for me, and should I take something instead? Jesse, I think this has a lot to do with the terpenes. Is that correct?
Yeah, definitely. When it comes to the tincture, as I said, it is very popular, but for some people it doesn't work. This is the really hardest thing about buying medical cannabis, is the fact that you really need to do a trial and error. It's hard to find just one product and think that one product will work for you when it may do the complete opposite than what you want it to. So one of the hardest things of my job is finding the right products to give to patients that are asking any type of these questions. Herniated discs, I couldn't imagine the pain from that, but I would say probably any type of topicals would probably help at least alleviate some of the pain. I use it for sciatica, which is most certainly not the same thing, but it definitely does take away the pain. So I think that topicals, when it comes to the herniated discs, anything that's happening way deep in the spine, yeah, I think that probably that would be the best bet.
And you brought up an important subject, and that is multiple routes of administration really help. It's not just a one-trick pony. It's not just I took some tincture drops in the morning and hope like hell they work. You really have to pay attention to tincture drops during the day, but augmenting them with vapes and augmenting them with topical products, and candidly with edibles really can help.
Absolutely agree. There's definitely a lot of people that try to, I wouldn't say mixing different routes of administration. That can help. But I've had some people say, can I take this with this? I think that the best rule of thumb when it comes to medical cannabis is always just start with what you're thinking that you're going to need, and then wait a little while, see how it affects you. This is how I always tell people when it comes to dosing, whether it's the tinctures or the edibles, you're always going to want to start with one, see how it affects you. If you feel, okay, I can take a little bit more and it won't bother you, then I would say go right ahead. But if you feel that you are at a point where you can stop, then that's where you need to stop.
Right. I think that's important. One good question that came up is I've had 3 cervical fusions and 1 cervical disc replacement. God bless. Really, seriously. That's important. My neck muscles are like a rock. What can help? Well, I have to tell you, 7 herniated discs in your neck. When your doctor comes in and tells you that you're his PB, personal best, that's not what you want to hear. Mine aren't necessarily, my neck problem isn't necessarily coming from surgeries, but it definitely is a problem. I have found that I concentrate a lot on using products that help me both with inflammation as well as with pain. Now, in many cases, when you have fusions and disc replacements, the whole key is to be able to just reduce that inflammation as much as possible from those particular procedures, so that you can get yourself into a situation where the pain management can help you, and also you feel a lot better. Jesse, your comments about using both reducing inflammation and pain for addressing both of those for pain. What's your comments on that?
Well, it's, again, I feel that it's very, very subjective when it comes from person to person. A lot of people like to think that there's one certain product that's going to take care of every ailment, and that's really just not the case. So when it comes to different types of problems that you may have, it's always best to pinpoint which exact ones that they are, and then just talk to your bud tender. Seriously, we are incredibly knowledgeable about these things, and we want to help. So if you want to know what the terpenes are, you want to know what it is that you're taking, please let your bud tender know. We are dying to help you with anything that you may need.
Well, it's not just knowledgeable. I think you also have some scar tissue. You deal with a lot of different people, and you see a lot of what people have taken and how it helps them. I think that's
Oh, yes. Well, yeah, definitely. I've seen that a lot of people do have a type of, it really depends on the person, but there's a lot of people that come in that always have, tightening in their neck, and they say, we get massages all the time. Those don't work. What can help? And again, it's based on person to person. It's a little bit hard to pinpoint, but.
right. Great. Now, one of the questions is, what's the best management pain for, in this case, a version of scoliosis? In this particular case, what you have is it goes back to the inflammation of the joints. What you're doing is your joint is now doing something that it wasn't naturally designed to do. And so that inflammation causes the pain. And I think that's where you get into the higher CBD products. What's fascinating is, in this particular case, using a product, let's say like a 4-to-1, 4 CBD to 1 THC, or even a 9-to-1 might be able to help you a little bit more. But again, as Jesse was mentioning, you may want to try that. Any comments you got on this, Jesse? I got there. But anyway, I would pay attention to I'd pay attention to the inflammation part of it. I think that'll help quite a bit. I've dealt with a number of patients with scoliosis, and again, we've paid attention to using. We found best reception is with a high CBD product or a higher CBD product, not more than a 1-to-1, going 2-to-1, 4-to-1, maybe even as much as a 12-to-1 that's out there. Recommendations for managing fibromyalgia and symptoms without getting high. Again, fibromyalgia is something that brings on a lot of pain. A lot of that has to do, again, with inflammation. And I can't emphasize more that in many cases, people believe that they have to attack the pain by going straight into into THC, when in fact, the real issue that the pain that's causing the pain is the problem is the inflammation. And in fibromyalgia, that's the case as well. Now, you still need to have CBTHC. I don't want to get around that. But I do think looking at a ratioed product to be able to do that will help you quite a bit. And this helps you without getting high. I have to, during the day, I do seminars like this. I do other things with respect to patients and in the medical marijuana world. I really can't be high. I guess I could, but it doesn't help me with my business very well. But I think my key is to be able to be pain-free, as much pain-free as possible, and be able to maintain my focus. And that's what medical cannabis helps you do. What can I use for rheumatoid arthritis? Boy, I've had a number of patients do this. We do an arthritis webinar where I actually had a patient who was in a situation where her hands were so arthritic that she could not, they were just clenched together. She couldn't hold a knife and a fork. She couldn't hold a remote control. She actually became recluse because she felt uncomfortable getting out in public, and really it wasn't really feeling comfortable. It had mental as well as physical aspects. We used medical cannabis. My aunt, for example, my godmother, has a terrible case of rheumatoid arthritis. We got her into some medical cannabis. In many cases, we used the one-to-one product. Again, depending on your body. In the case of my godmother, we used the higher CBD product, a 4 CBD to 1 THC. It helped her a lot with the arthritis because, again, we're getting rid of the inflammation. In certain cases, with one other patient that we had, we used more of a one-to-one type of product because, again, that was what we found to be effective. Pay attention to the CBD to THC ratio, but the answer is yes, it is very effective with arthritis. In the case of the lady that had Nana was actually her name is grandmother. She wasn't able to hold a fork or a knife or even go out in public or hold a remote control. 3 months later, she was out in public, being able to get back into her social life. And about 4 months after she started taking medical cannabis, she started knitting again. And I have to tell you, she got a hold of me and she was just on top of the moon. It does help. It doesn't get rid of it. It won't remove it, but it'll help you manage it. I think that's important. What is best for deep bone pain and muscle aches? I've had a hard time finding pain relief without using more THC than I want. Jesse, this is right up your alley.
Yeah, I would definitely say that probably the best route to use for this would be when you're talking about deep bone pain and muscle aches, you could definitely help with the infused balm that we were talking about before. Any type of topicals will definitely help with any surface pains, muscle aches, anything like that. Now, when you're talking about deep bone pain and really deep-seated pain, it is always best to use a higher CB or a higher THC tincture. That's the best that I found. Is the relief formula does encompass a lot of the pain relief that you get with really, really deep-seated pain. So working pretty closely with that, I've determined that the relief formula is probably going to be the best for anything that's really, really deep-seated: fibromyalgia, multiple sclerosis, rheumatoid arthritis, things like that, where it's really deep and deep hurting pain. The relief does help because the high THC amount does get deep into the systems. Without using more THC than you want, I would say that probably a higher CBD tincture may help too as well.
Yeah, I think, and I think a good point. And I should go back to the rheumatoid arthritis issue. Topicals work very well for that. Very, very well for that. Something to pay attention to right there. Best strain to deliver relief for migraines. Now, we know that migraines are caused by a lack of endocannabinoid system. Jesse, what's your recommendation for that?
All right. So when it comes to migraine pain, I say that probably the method that works the best would be, again, topical, because when you're talking about migraines, one of the tricks that I've actually found with the balm is that you actually use a little bit and rub it right onto the temples. And since it's getting right into the area where that pain is stemming from, it definitely helps. And it just makes that pain. I've used it multiple times for that reason. I get headaches quite frequently. And just to rub that balm right into the temples, it really helps alleviate the pain. Strains vary. I
would say instead of asking for strains, look for the terpenes. Pay attention to the terpenes that address, because you'll find that the terpenes are really what's bringing the medical value, and the strains, all they do is just open up the receptors for you.
Yes, very true. That's always something that I try to tell my patients is that the terpenes are very, very important. THC is important, CBD is important, and terpenes kind of encompasses all of that. When you're talking about the aroma, the taste, and the effects, it all comes from terpenes. Very, very important.
Right, right. Dealing with chronic muscle and joint pain. This is really important because, especially with athletes, we get a lot of that. You want to talk about a route of administration and the product they're looking for? Again, which terpene profile?
For muscle and joint pain, I would say probably, again, it does keep coming back to those topicals, but for me personally, I love to use the patches. So if it's something that's on the joint, you can actually use the patch directly on that area, and it should send all that medicine directly to the point. So it is hard to kind of determine which ones, depending on the muscles, but I would say that, yeah, again, it does come back to topicals. It is very, very underrated route of administration.
Key with the topical patch is that when you put it on, it lasts about 8 hours, which means it's what they call microdosing. It's giving a little bit of medicine all day long rather than taking it once, in one setting and then hopefully it works through there. Microdosing is very, very important, and I think it's something that can help quite a bit with chronic muscle pain and joint pain.
Essentially, it's like a time release medicine.
Right, right, and that would be very, very helpful for those particular cases. I've also found that in my particular case, I get to do some workouts, and I get into martial arts, which is a whole different game. And I found that the RSO, the FSO product, helped quite a bit in the evenings to be able to address that. Now, that's just me, okay? I'm not necessarily saying it's a golden rule, but I found that trying different products for that really makes a difference. What terpene is best for pain and which terpenes for sleep? You want to address that, Jesse, or you want me to take that?
No, I could actually take this one. Like I said, I work very closely with terpenes. The best, I would say that probably the top terpene for pain and sleep, if you want to take it as a joint, would be the myrcene. Pain by itself, I would say that caryophyllene has great anti-inflammatory properties. I actually suffer from Crohn's disease, and that is the one terpene that works the most. Right. For me, I usually take CBD, and any type of strains that have a good amount of caryophyllene will definitely help with the inflammation and help me get to feeling way better. Sleep, myrcene, 100%. That's probably going to be the one that gives you the most sedation out of all the terpenes that we are covering today.
Right, and I think the other thing about sleep is to pay attention to how long the coverage is. In many cases, a tincture drop will last 4 to 6 hours, where a gummy or a chocolate will last all 10 hours. So you got to pay attention to the route of administration as well.
That's actually something that came up today with one of my patients. She said the exact same thing. She doesn't have she gets to sleep fine, but she wakes up in the middle of the night. I would take something that has a little bit more to.
Yeah, I think if you get that coverage for the whole
gives
evening,
you a little bit of time. As you mentioned, the tincture is a great.
Yeah, tinctures will get you started, but they won't going to cover you. They're not going to cover you for the whole evening. That's for sure. What to take for shoulder and neck pain. I think we've addressed that a couple of times with some of the answers that are there. Mike, again, I'm just going to have you remember, get something that'll last 24 hours. Pay attention to what you're doing in the morning, the afternoon, and the evenings. You don't want to get high during the day. You don't want to get high at night if that's something that you're not looking for. What you want to do is you want to address the pain, and that's where using combinations of both vape pens or vapor inhalation, tinctures, as well as gummies and chocolates can help quite a bit. I think we've talked about that, and we'll give you some recommendations on that. What's best for chronic pain for spinal infusion with nerve damage and pain? I think we've talked a little bit about that. I think this is also where the patch can come into play. Is that right, Jesse?
Yes, actually, the nerve damage and pain, and just since I'm looking ahead for the best route of administration for controlling sciatica, is it possible that I can take these two questions at the same time?
Both, go for it.
Fantastic. So for the person that sent this question, I do feel it. I suffer from sciatica too. It is incredibly painful. I will tell you that the best product, in my personal opinion, is going to be the patch. So the patch is going to go directly to the spot. Usually people that have sciatica, they can feel exactly where the pain is stemming from. At least I can. I can feel exactly where it's coming from. To put the patch directly on that spot is going to direct all of the medicine to that spot and hopefully alleviate all the pain that you're having that's causing it from it. Because you know where it's stemming from, hit the pain at the source, and then it just helps alleviate all the rest of the pain that you're having.
Right. And I think that also addresses the next question, which is the best way to support joint pain.
Yes, again, any type of topicals, that's, I see that a lot of these questions do have to do with joints, surface pains. It's going to be topical. A lot of people do like to think that it's great to use strains or smoke or vape for all this. Very, very underrated is the topical because it gets to the point exactly where you need it. If it's not an all over body pain and if it's to one localized point, you can find a product that will pinpoint that pain specifically, and it helps tremendously.
Sure. Yeah, and that's really, really key. If you hurt your elbow, you hurt your joint. I just finished doing some moving and I had some knee pains and I used topical. It helped quite a bit. So yeah, again, that's why there's various routes of administration with cannabis, and that's what makes cannabis so great. You're not stuck with taking just a pill. You have different routes of administration to really target that pain and target that particular situation. Do I have to live in the state of Florida to get help in Alabama? Well, each state has their own program. And I think that Florida has one. I know Mississippi now has one. Alabama's got a program, although I think it's kind of like the chick that's in the egg. It's coming out of the egg right now. I'm not sure it's really fully hatched and really up and running. But in order for you to be able to use medical cannabis legally, it has to be approved by your state. And again, that just depends on the rules and the implementation that Alabama has and that has in play. Unfortunately, because it's federally illegal, that's the way the laws read. I'm not happy about it, but please don't shoot the messenger. That's what's out there. Does oral CBD interfere with current medications? Jesse, you want to take that one?
This is a little bit of a tricky question because I'm going to say not necessarily, but it definitely does depend on the medication that you're taking. That's probably
Yeah, CBD, cannabis has been known to not interfere with a lot of medications. The only time you have to be very careful about cannabis is if you're taking medications if you're on blood thinners or medication for your heart, because remember the endocannabinoids are distributed through your body through your bloodstream, and so that doesn't mean you can't use cannabis when you have blood thinners and heart condition. It just means you adjust your heart medication and your cannabis for that. This is where your doctor and your medical marijuana doctor can work together. Classically, what you're doing is you're reducing the amount of the heart medication and when you're using CBD that's out there. You want to make sure that you don't get blood too thin. That's what's really, really important. What's the fastest method besides vaping to get relief? I use vape pen. What is the recommended temperature? Great question. And I think that's why we had that slide on temperature. In the case of pain, you'll notice that all the terpenes that really provide the best pain relief reside and work below 350 degrees. Jesse, you want to attack that? You want to address that one? I think we lost Jesse's audio for a minute. But I think what you want to do is, so I recommend, I have a dry vape pen, and I also have a concentrate pen. And in both cases, I set them for 340 degrees. And I found I get the great flavor from the terpenes, and I get all the terpenes, and it really helps much more effectively than setting it at a higher temperature like 360, 370, or even 400. So I think that's the fastest method of vaping. I prefer concentrates because I find that I can get the right terpene profiles, and again, getting the right concentrate pen is really, really important. I know Surterra has some products that you can pick up and purchase from them that will help quite a bit. But I think it's really key that I find that again, right temperature, right pen, right product, right terpenes make a big difference. How best to use not only THC, but what forms of CBD should be using? CBD, CBDA. Great question. We just did a webinar 2 weeks ago on cannabinoids. We talked about all of the different cannabinoids that are out there. The best method depends on what you are trying to achieve, what you are trying to target. Again, these are all what we call cultivars. They're all being made for a particular reason to address a particular situation. So I really can't answer which is the best form because I'm trying to figure out what you're trying to accomplish. But I can say that the different cannabinoids all work synergistically, and CBG is always great. CBD itself is always great. CBDA is great. So again, CBDA is great for pain relief, for inflammation, which helps relief and pain relief. So hopefully that's something that's there. I seem to have a reverse reaction due to ADHD. Or is there compensation for this? Jesse, you want to take that or you want me to take it? We lost Jesse. Okay. Um, in many cases, people pay attention to how tolerant they are to CBD or to THC, excuse me. I know of people that are actually have negative reactions to CBD. That can happen. And so, in many cases, when you say, what is the reverse reaction? You might be one of those patients that has a lower tolerance for CBD than normal. And so, the way you compensate for that is the regime we follow is go low and go slow. Try a one-to-one product, find like a tincture drop, take 0.125 milliliters, try that for a day or two. If they don't get a reaction, move up to 0.225, go to 0.5. In other words, go low and go slow. You'll be able to find where it reacts to that. In your case, what you might want to do is also pay attention to using a little bit of a higher THC and lower CBD product, if in fact you have a negative tolerance to CBD. That's something that's out there right now. A new recommendation from a doctor necessary for purchase. The doctors, in the case of medical cannabis, you don't need a doctor's recommendation. What the medical marijuana doctor will do is he'll give you what they call a recommendation. They'll say, here's products that you should take a look at. Again, if you look at your body, every person's body is different. Your metabolism, your body type, basically your genes are all different. Some people can, again, take a little bit and it affects them, and some people can take a lot and it doesn't affect them. The doctors want you to go low and go slow. What's fascinating is I did a medical conference about 6 months ago. I was sitting with the medical doctors, and they were talking about how pharma drugs have exactly the same problem. When you say take 2 pills and call me in the morning, that's why they're doing that, because they got to figure out how it works for your body. One of the things that medical doctors don't like is the fact they've got to work one-on-one with the patients to be able to get their dosing correct. The case about medical cannabis is you can go slow and go low and go slow. You can take a little bit more. And more importantly, you can listen to your body. You don't need your doctor to tell you if you're feeling better. Your body will tell you. So my recommendation is your doctor won't give you a recommendation because he doesn't know. He doesn't know your body. But by going low and going slow, you'll be able to figure that out. Now that's called dosing. And I do want to tell you that at the end of last week of June, I'm doing a webinar on dosing. Please join us for that because that might be very helpful to you figure out, get your regime back. Will the topical ointment with THC and CBD show up on a drug test? Jesse, you want to address this one?
Actually, to be honest, I'm not entirely sure the answer to this question.
Okay. Well, the answer to your question is a lot of people will say, I'm going to only take CBD or broad spectrum CBD because it won't show up on a drug test. Well, the answer is it will. Okay. Anything that gets into your bloodstream will show up on a drug test. Now, certain topicals don't necessarily enter the bloodstream or don't necessarily enter your body to a point where your kidneys and your liver actually register them. So I would say be cautious. If you use a topical ointment, there's a possibility it will show up on a drug test. What you don't want to do is try one and it does show up. Again, every person's body is different. But again, be careful. I know a lot of people are, a lot of companies are anti-cannabis, and unfortunately, and they do a lot of drug testing, and I just wouldn't take the chance, the best way of putting it. I know I don't want to have people live in pain or have a problem, but I also don't want them to lose their job. So I would say be cautious. I would say there's something that's there. Back pain, scoliosis surgery in younger years. Same thing. You're trying to address is pain and inflammation. Jesse, you want to talk about that?
So back pain and scoliosis surgery in younger years. This is, it's a little bit tricky. It depends on how young the patient would be, because we are definitely able to prescribe some products to pediatric patients. But again, younger years, I'm thinking probably like early teens. This is tricky, but I would say that probably any of the tinctures would probably take care of that, would really help with the pain. Any type of relief formula is going to really take care of all over body pain. So if you're taking the relief formula, it's going to pinpoint the area and hopefully alleviate it.
And don't forget the topicals and the patch. They'll help quite a bit.
Absolutely.
It's out there. That's something that's really important. You know, it's not just a matter of which strain and which terpene you have. Sometimes the route of administration can be really helpful as well. And that's where, again, with pain, topicals really come into play, and that's really important. How to best treat osteoarthritis in hands. I'm young. I have pain 0 to 6 in an elbow, a wrist, 4 months strength loss. That's something that is, again, the byproduct of arthritis, whether it's osteoarthritis or rheumatism. Again, Jesse, I'm gonna let you address that, because really what we're doing is we're targeting the inflammation and pain, right?
Absolutely. I feel that, again, topicals, as we've been mentioning, that balm is fantastic for nerve pain in the hands. I have a friend of mine who actually personally requested, after she got her card, she said, would this work for me for the nerve pain in my hands? And I said, it's worth it to give it a try. And she said that it helped tremendously. So that's probably a better, again, a really good route of administration, because you don't have to worry about any inebriation. You don't have to worry about being inebriated at all. So I think our osteoarthritis in the hands, definitely with the topicals would help tremendously.
And pay attention to the terpene profile, because again, that terpene profile will help quite a bit to really address and attack that particular situation that's there. Best products for acute pain in the knees due to no cartilage and arthritis. I can relate to that, because that's where I was before I had my knee surgery. I had absolutely no cartilage. I lived that way for a couple of years, and unfortunately too much pain. And then I discovered medical cannabis, which made a big deal. The best products, again, I think, go back to paying attention to the right terpenes and the topicals, right, Jesse?
Yes, 100%. Acute pain is a little bit easier to manage, so you may not need as much THC. This is really great for people that are doing the 1-to-1 ratios. And also, again, the topicals are going to be 1-to-1. That would be great for the knees. I know a lot of people that use it for their knees. Also, the patches to put above the knee as well can really help.
Right. I think that's really important. Carpal tunnel, you want to address that too? Because I think carpal tunnel falls in the same category of treatment as the arthritis.
Yes, 100%.
Yeah. Pay attention to topicals. And again, that terpene profile is really important. I cannot emphasize more that cannabis is something where when you go low and you go slow, you literally, maybe you'll do the first couple of days, you won't feel anything. Next couple of days, you won't feel anything. Then all of a sudden, you'll begin to feel relief. And when you feel relief, you will know it. You'll be saying, boy, that's really there. I think it's important that you listen to your body, and you will get the relief that's there. Go low and go slow. I wish I'd have learned that when I was learning how to drink alcohol in college, but it's something that really pays attention here. I think that's what you'll get your best relief from that's there, especially with carpal tunnel. I've seen good results from using both patches as well as using products that have both myrcene and caryophyllene in them. This is one right up your alley, Jesse. Crohn's and intestinal cytosis.
Yeah, I have a very, very close relationship with Crohn's. Unfortunately, it is very hard to find specific strains that work. However, I will say personally, this is again personally speaking, it may be different from person to person, but the best product that I've used for my Crohn's is a strain called Sour Diesel. It is the only strain that I've taken, and I've taken hundreds, that actually completely eliminates the pain. And what I think the reason for that is due to the terpenes caryophyllene and limonene working together.
Right. Yeah, and that's really important. But it really helps quite a bit. And you can use it whether you use it in flour or whether you use it in vape pens, and it can help quite a bit. And also pay attention to those terpenes that are in tinctures as well.
Yes. Again, when it comes to vaping and using products for Crohn's, always look for caryophyllene in strains that are either hybrid or sativa hybrid if you want to not have any drowsiness, because there are a lot of strains that will help in their indica. But if you're not looking to get tired and fall asleep, definitely want to go for more of a hybrid or a sativa hybrid strain that contains caryophyllene.
Best for COPD. Jesse, right up your alley.
Again, the relief tincture is probably going to be the best again for this, because any type of pain, I mean, pain is very general, but if you're speaking about pain relief, which is what this whole seminar is about, I can't stress enough how important the tincture is for longevity and for the ease of use, because it's not like a bad tasting oil or anything like that. It's actually very pleasant tasting. So for people that aren't into inhalation and maybe not looking to take any like candy based edibles, the tincture is going to be one of your best friends.
Right, it's really there. So we've tackled a lot of questions. We have a few more. These are the live questions that came up during the webinar. It says, what type of product do you recommend for headaches that will help me and not leave me feeling high? Jesse, you want to attack this one?
I actually mentioned this before. Using the balm to rub directly on your temples will help you with the headaches. And since it is a non-psychoactive product, it won't leave you feeling high. It will just hopefully take care of that headache pain at the source.
Right. Dina had a great question. Looking at surgery and again using cannabis instead of narcotics. Really, I found that with when I did my Jewett experiment on my knee surgery, it was wonderful. I was shocked at how well it worked. The doctors were shocked at how well it worked. But the key is, if you're taking CBD for anxiety, you've got to add some THC to be able to address the pain. Do you want to chat about that, Jesse?
Yes, THC is extremely important. When we're talking about pain relief, it's going to be one of the main things that you're going to want to look at. Again, the terpenes are going to be what makes the most out of the high that you're going to be experiencing. But if you're looking to use it specifically for pain, definitely want to just keep an eye on those terpenes and make sure that it has a good amount of THC. It doesn't need to be super high, doesn't need to be super low, but if it's a moderate amount that you can handle, it's definitely going to help with the pain relief.
You know, a 1-to-1 would work great to start to see, again, you get your tolerance for THC, but then maybe you want to try a 4-to-1, maybe even a 12-to-1, depending on your body. But you can, I think, having that THC there, CBD and THC work great with pain. They work together. That's an entourage effect. But again, it depends on your body. I would say make sure that you have some THC there to be able to address that particular issue. Is it true that the higher THC products, especially smoking, marijuana, can cause more inflammation rather than lower it? I'm going to go back to what I mentioned earlier. The minute you smoke cannabis and you put that flame up to that particular joint, you're burning off a lot of the medical efficacy, and you're probably seeing some issues that are there. I have not heard that THC causes inflammation. What it doesn't do is it doesn't address inflammation. It's not as effective an inflammation as THC. Do you want to comment on that, Jesse? Or CBD, excuse me.
Yeah, no, that's the thing with the higher THC products is it's been kind of ingrained in culture that high THC means that it's a better quality flower or product. Not the case. As we've been talking about extensively, terpenes are going to be how you feel the way you feel. The reason why somebody might be smoking the same strain, one person feels great, the other person doesn't feel as great, is because the terpenes are responding to the first person's body more. So when it comes to THC, I try to tell my patients, when you're looking for a strain, like as you said, as soon as you put that flame up to it, it's burning off a lot of the flavonoids and the cannabinoids. It's not going to cause any inflammation, but it could definitely help. Like I said, one of the best things for my inflammation has been sour diesel, and that is a high THC strain.
Yeah, and it has it has the right terpene profile that's out there. Key is terpenes and CBD working together. Carol's talking about using a indica tincture at night for migraines. Would it be helpful to use a sativa during the day? It just depends on you. I mean, it depends on what you want to do and what you want to accomplish. Sativas will make you more energetic, where indicas will get you more relaxed. And again, during the day, you may want to be more energetic. It really depends on the outcome that you're looking for cannabis. I'm going to jump into Ted's question, and I'm going to really tee up Jesse for this. Jesse, Surterra has a consultation. Would that be the best way for Ted to go?
Yes, absolutely. The bud tenders are going to be the people that are going to be exactly what our title is. It's guide, product guide, Surterra guide. We want to make sure that your journey of cannabis is going to be a pleasant one. We're not looking to make you buy anything that you don't want to buy. We always listen 100%, make sure that the products that you're buying are going to be helpful, not just get you stoned. That's not what we're looking to do. That's what I like to tell all of my patients, is that when you leave the store, I don't want you feeling high. I want you feeling better. So your bud tender will gladly help you, no matter which one it is, no matter what location. We're all very qualified to make sure that you get exactly what you need.
And it's going to be a process where you may need to do a couple of consultations, because you're going to try a number of different products to find out how they react to your particular body, as again, in the dosing process.
Yes, very true. I have a lot of people that come in multiple times and they say, hey, you helped me last time, and what you gave me last time was fantastic. What can we do for this? And then, I just hear what they have to say, and this is the best of my knowledge, give you the product that's going to help you.
Yeah. Jeffrey, multiple knee replacement surgeries. I can relate to that. I think we've talked about that a couple times during this particular question and answer period and webinar. I can't emphasize more. Cannabis works so much better than opioids and pharma drugs. It's just absolutely amazing. It's one of the things about the Percocets and that type of thing is it really constipates you, and that's not fun. What I found is I was able to relieve or get around a lot of that by using medical cannabis. But what I did was I had a program, more important, I had a program ready for me. When I had my knee surgery on Monday, I had to take Percocet in the hospital. Tuesday, they gave me some Percocet. I used it a little bit. But on Wednesday, when I was released, I actually took no Percocet. At lunchtime, when I got released, we literally went into the parking lot. I hit the vape pen and I hit some tincture drops. And by the time my wife was driving, by the time she got to the street, my pain level was down to a 1. So again, vaping with tinctures, getting the right formula really works. And I had to experiment. I have to tell you, I had to do some adjustments going along. For example, in the evenings, that's when I discovered using chocolates rather than tinctures would let me sleep through the night. So you may want to take a look at that. You will have months of rehab. There's absolutely no question about that. But again, if you're using the right cannabis products, it'll help you, and it's not gonna, as you say, it gets around all these GI tract issues that you have out there. Jesse, you want to touch on that for a second? Because I think that's important.
It's super important. I really don't agree with opioids. I believe that it has more harmful effects than good. I do believe that with THC and CBD and synergy, it can absolutely help with this. With the rehab that you're looking at, months of rehab is never a good thing. Never something that you're like looking forward to. But I think to help alleviate that pain, using tinctures, using flower, whatever works for you. Because like Marc said, it's all about experimentation, just seeing what works best for you. Because there's something that you may not even knew about that one of the bud tenders suggests to you, and then you try, and it's your godsend.
Right, Sarah. Chris has a great question. You're out, you can't find the product.
This happens every so often. So right now I know that the Soothe lotion has been out at a couple locations. It's not that it's going to be gone forever. They're just working on improving the formula. But that's anytime that you see that a product isn't in for a while, they're just a distribution, improving the formula and making it better. It is coming back. I do know that we are getting it. I can't say when. But it says here that super effective for my tension neck syndrome pain. I think that the balm would definitely help with this as well. Any type of surface pain that you're going to have on, especially towards your neck or your shoulders, the balm would be fantastic.
Right. And it's important to point out that cannabis is a botanical product. It is grown indoors, but being able to grow it and based on time of the years and seasons also come into play. So that also is a factor that's really out there. So, and I know Surterra is doing a lot to improve the product. So bear with, but I think you want to get that product in stock as much as the patient does. Is that safe to say, Jesse?
Yes, it also depends on popularity. The Soothe lotion is incredibly popular. So when people see that it is in, they usually get like, 2 or 3 to make sure that they know you may not have this in the future. I should get a few of them. So that does come into play. But yes, they're always improving formulas and just making sure that we're giving you the best product.
Right. Lynn, you have a great question. You brought up about severe neck pain. I can relate to that. But also you brought up something else. The doctors talked to me about shots and a number of different things. I found I just alleviated all that and used medical cannabis because I found it to work a lot better. The shots were a temporary relief, but didn't really solve the problem. Now, in your particular case, if you have a pacemaker, it's really important that you make sure that your doctor and your medical cannabis doctor talk to make sure that you get the right medications and the right formulas that are there. Not that you can't. I have patients that do have heart conditions, that do have pacemakers, that have been on blood thinners, and they use medical cannabis very effectively. But in all cases, we've sat down, looked at the pharma side of it, looked at the medical cannabis side of it, and come up with a regime that works for that particular patient. And again, we've experimented with a few things to make sure. By experimenting, meaning we go low and go slow to make sure it's not causing any negative effects that's really out there. I would say this is where you really want to check with your doctors to make sure it works. But there have been very positive cases of using cannabis with people that have both heart conditions, pacemakers to address pain. Jesse, you want to comment on that at all?
Yeah, I feel that the relationship that you have with your doctor and your medical doctor definitely need to be married when you're using the medical cannabis, because your physician may be your medical doctor or medical marijuana doctor as well. But again, it's a very tricky thing, especially when it comes to people with heart conditions. But when you come in and we talk to you, just tell us what you feel will help, and we'll get you that point.
Paul was mentioning he did some FSO and felt nothing. Now what? I think this is, again, something where you need to take a look at terpene profiles. And I would say also how he's taking it. Your comments on that, Jesse?
It says took half of the syringe. If you took half of the syringe at once and felt nothing, that's very, very rare.
God bless you.
Yeah.
I've never seen that.
I've never
a syringe should, again, this is like Bacardi 151. You should definitely feel it.
That's 100%. I'm really that's as soon as I saw this question, I'm like, wait, what?
Because I think the best thing to do is why don't you schedule a consultation with Surterra, because I think something is wrong here, not with you, but we got to get something right. Because half a syringe you should feel it, and so let's make sure you're getting the right product. Let's make sure you got the right terpenes, that you're using it, if you're taking it effectively. That might have something to do with it. It's out there. You want to take Christina's question? This is right up your alley, Jesse.
So she says she has osteoporosis, migraines, and a pinched nerve in her neck. What can help with that? Again, subjective, but it depends on the severity of the issue as well. But I believe that there's a lot of products that can definitely help with that. The topicals that we had mentioned, the tinctures, I think are probably going to be the best for these particular ailments. So I think some type of regimen that you may have with using it in congruence with each other would probably be best. For the migraines, like I said, applying some balm to the temples will help. The pinched nerve and the osteoporosis will probably help with the relief tincture.
Right, it's really out there. Just a comment, RSO is excellent for extreme pain. I had an awful colitis flare-up and had continual stomach pain. It took it for months. As you know, I said go low and go slow. I actually vomited by taking too much. That is really true. RSO, FSO is the 151 Bacardi. Go low and go slow. It's very effective. You don't need a lot of it, but that's where people think more is better. In case of cannabis, and in many medications, more is not better. Your comments, Jesse?
Yeah, again, ulcerative colitis, very familiar with that, unfortunately, but continual stomach pain is actually a very common thing for me. It always comes up in the morning. RSO, using that for the pain relief that you're getting from your stomach pain, I'd say that it would help, but again, the smallest amount possible just to start. You can always take more, but you can't take less. Like he said, he vomited from taking too much, which is never what you're looking for. So always best to start with, we say, a grain of rice, the size of a grain of rice, and then, apply more from there, but always wait about an hour before you start to feel the effects, and definitely make sure that those effects are at their peak before you decide to take more.
Right. William had a great question. In the morning terpene pain, morning vape pen, what do I look for? I'm looking for really three things. I'm looking for myrcene, I'm looking for planine, I'm looking for caryophyllene. Those are the three that I primarily target, and if possible, limonene that's there. Those are kind of the top players that I look for with my vape pen in the morning. And by the way, sometimes I'll use either a dry flower device, which lets me use dry flower, or I'll use a concentrate pen in the morning. Not necessarily one that's a vape pen itself, but it's a concentrate pen that's there because it helps me target that. CBN is great. CBN is really good for sleep, not necessarily to wake you up to put you back to sleep, but CBN is really good to address pain, and being used during the day can help you address pain without getting high. Jesse, your thoughts on that?
CBN, even though it hasn't really been too widely used in products in the medical cannabis industry, it is coming up and a lot more people are becoming aware of it. It is great. For the question though, in the morning vape pen, what are you looking for in your COA for your top terpenes? I would say that probably for morning, limonene would be great. Just to kind of get you into the groove of wanting to, the motivation in the day, wanting to actually go out and do the things that you need to do. Also great for anxiety as well. As Marc had mentioned, caryophyllene, great for the pain, stomach pain. Like I said, that's what I take for my Crohn's, which the flare-ups always come in the morning. So I always need some type of sativa that helps. The best thing that I've used for morning pain would be, as you mentioned with your with the dab pen, would be I use live rosin.
Right.
Any type of sativa live rosin or hybrid live rosin really does wonders for me in the morning.
And I have to tell you, I'm a rosin and resin fan.
Yes.
I prefer rosins and resins. When you ask me what my vape pen is in the morning, it's usually a rosin pen. Okay.
It's
And
fantastic.
I have a device I can set 4 different temperatures on it. And obviously I'm setting it in a range that's less than 350. I highly recommend it. That's one of the big secrets, I think, to really pain management out there.
And it's also great for people that are big fans of taste. I absolutely love flavor in my strains, and I think that the most flavor comes out in the live rosin because it's retaining the most flavonoids and terpenes. So you really taste it when you're dabbing it.
Right. Forrest, I think this is a question for you. Does Surterra site have search options for products for particular terpenes?
I laugh about this because I would love for it to. It does not currently. We are working on it for sure to be able to do this. But what I would say in the meantime is you can go into any store, talk to somebody like Jesse who can help you out with those particular terpenes. Or our call center as well can pull up. We have a spreadsheet on our side that we can look up all of the terpenes in every product very quickly to be able to look those up for you. So don't have it now, working on building it in, but we definitely have options to get that information to you.
Yeah, and I think it's something I know that we've talked about this in the past. You're working on very hard, and it's a matter of your website, folks catching up to the demand. So hopefully COAs are coming to a website near you very soon. So, Dre asked what effect, if any, does vape pen have on the lungs? First of all, vape pens are steam, and anything that you put into your lungs, you have to be careful because your lungs are very, very sensitive. Although in certain cases, cannabis can be very helpful to the lungs, just like people who have asthma use vape pens or use an inhaler for their lungs. It's the same kind of thing with cannabis. It can be very good for you depending on the product. So it doesn't have the carcinogens that you find in tobacco. The carcinogens are things that really, really bring into cancer and various negative things. But it does have some steam that's there. My recommendation is buy a high quality vape pen. It has less harmful reactions to your lung that's there. But don't be afraid of using it. I know that some people died years ago from vape pens that were unregulated, that were brought into a market where the government didn't test them, and it was a backroom product. Here in Florida, and in most of the states that have medical cannabis programs, those vape pens have been tested twice inside by the company itself and once in a third-party facility. So the vape pens tend to be very safe and they have been tested. I think that's an important part, right, Jesse, to make sure the testing has been done.
Yes, there's a lot of people that actually come into my job that deter away from vape pens because they've heard on the news that they are harmful. I can be the first to tell you that I use vape pens quite exclusively. Vape pens and flower are my go-to. And while they're still going to have an effect on the lungs, I mean, it is, in generally speaking, it is going to be healthier than smoking actual flower. But I've had many people say, "Oh no, I don't touch vape pens. The news said that those are terrible for you." To be honest, if you find a strain that has pinene, the terpene itself is a natural bronchodilator, which actually opens up the airwaves and actually gets a little bit more air in the lungs.
Right. Jerry had a good question. Does any THC products have anti-inflammatory properties? It looks like he's taking a medication from Mayo Clinic that could potentially damage his kidneys. I don't understand it all, but I get the direction that he's headed. THC really is good for pain. CBD is really better for inflammation, but if you can't have CBD, I think what you want to do is you want to take some, you want to actually look at the terpene profile of the THC products that are there. This is where you want to take a look at the limonene. You may even want to take a look at like a linalool. Is that safe to say, Jesse?
Linalool is good. Limonene is good as well. It helps with the anxiety. Anti-inflammatory, like I said before, probably the best is going to be caryophyllene. If you can find a strain that has all three of those terpenes in it, that may be exactly what you're looking for.
And Forrest, a question that's come up that you've never heard before: what happened to Coral Reefer?
So it's actually just not a brand that we sell anymore as a brand. However, we still carry the product. So we've talked a lot about that balm, the Fix tonight. That Fix balm is still available. The chews are still available just under our Heights brand. And the vape pens are also still available under Zodiac by Float. And so all of the products actually do exist. They just don't exist as the brand Coral Reefer anymore.
Right. You have the brand, you have the product, but not the brand. I think if you go into the store, the bud tender will help you figure out what those are.
Yep.
Great.
I've actually had this question many times before. It's not, again, it's the same, it's pretty much the same product, would be the Zodiac line. Those are still the products. If you ask if you tell the bud tender what it was that you had in the Coral Reefer line, we can correlate it to the new product.
Sure. And again, I'm going to throw one more shameless plug in. Please vote for us for the Cannabis Action Awards. Suncoastnormal.com. There's a link that will send you in the email follow-up. I should point out, as a follow-up to this webinar, you'll get an email that'll have a link to the video. It'll have a copy of the presentation. It'll give you all the notes, including some of the regimes that we use for knee pain and for surgeries. It's going to also give you reference notes, information about Surterra. That'll all come in an email that'll be sent to you right after this in the next day or two. You'll be able to get that. And part of it is a link to really vote for us. And thank you very much if you do. Again, we just want to get recognized. If it's something you feel has been important and has helped, help us out. Thank you very much. I think we want to kind of wrap up the webinar. And there's a couple of points that I want to bring up. Jesse and Forrest, what final comments?
I would probably say that it's always best to come in and just speak to us. That's probably the best. If you're not, if you're unsure about anything that you might be taking, or if you're new to the product, new to medical cannabis in general, the bud tender is going to be, that's what we're there for. We are your guides. We want to make sure that your journey is going to be as happy as possible. So our extensive knowledge will definitely come into play. So any questions that you have, come in, fire away, and we'll get you what you need.
I can't emphasize enough the consultations and how great they are and how they work. I would really pay attention to that. And I think one of the advantages that you have at Surterra over a lot of other dispensaries is you've got a quality consultation program. I think it shows the care that you have, right? And you want to pay attention to the customers and to the patients and really help them get the medical value that's there. Forrest, any closing comments?
Yeah, I would just say, talked about a lot tonight. Topicals resonated a lot for everybody that's struggling with pain. Go to those topicals. A lot of start low and go slow. a lot of journaling, figure out what works best for you, what doesn't work, and look for those terpenes. The terpenes kept coming up tonight. So a lot of what everybody's asking, while they're different conditions, it's a lot of the same answer for them. So good luck with everything.
I want to mention, if you're looking at getting a medical marijuana card, what you want to do is you want to go to MMTC of Florida. They have a program that can help you. There are 25 clinics here in Florida. And if you use the code MMWW15, you'll get a 15% discount on getting a medical marijuana card. And again, that'll be included in the email that we'll send as a follow-up. I want to thank Jesse and Forrest. Thank you very much for helping here. You've done a great job of being able to help us really explain pain management. It's an important topic. Thank you very much. I want to be here to help. Thank you. I also want to compliment our moderators in the background, Lee and Leah. They're the ones who really make this all happen and hopefully run smoothly. And thank you very much. And I want to point out, next week, we do not have a seminar on Wednesday. 2 weeks from now, we're having one on anxiety and stress. So I know that was brought up quite a bit by a number of people. Please join us for our anxiety and stress webinar. That's always a very popular one, and we can help with that particular piece. Lee and Leah, thank you very much. And I want to give a shout out to Alyssa Katera, who came up with the idea of putting this all together. I hope this helps. Our goal is, if we can help one person get their life back, then I think we've accomplished what we wanted to accomplish. And I want to thank everybody for joining us. Hope to see you in 2 weeks with anxiety and stress. And I look forward to your comments about the follow-up email you're going to get.